Hi guys, this is Dr. Mina and you're watching Health and Wellbeing with Dr. Mina. Our topic today is diabetes. Let me first explain what diabetes is, what different type of diabetes is, and why you need treatment and what are the problems if you don't treat it. Diabetes is, let me explain this. All our organs are made up of cells. So cell is the building block of everything in our body. Now, there are blood vessels that are like channels or canals that are supplying the nutrition to the cells. These blood vessels carry blood to the cells to give up nutrition and pick up the waste and take it for excretion or expulsion. So in the blood, when the blood sugar levels go high, that is called diabetes. Now, blood sugar levels have to be maintained very well, and there's a hormone called insulin that maintains the blood sugars level. So when your blood sugars are high, the insulin makes extra sugars go into the cell for it to be used for nutrition. If it is more than that, then your blood levels are very high. If your blood sugar is low, then insulin works to break down the fat and the glycogen in our body to convert it into glucose so that can be used by the cells. So diabetes is high blood sugars level. Now, there are two types of main diabetes. There are many types, but mainly two types of diabetes, type 1 and type 2. Before you have diabetes, it's called pre-diabetes. In pre-diabetes, not all the types, but type 2 can be before pre-diabetes. In pre-diabetes, your blood sugars levels don't go very high. They're just slightly on borderline high. But studies have shown that at that level, they start causing damage in the blood vessels. The inside of the blood vessels, they cause damage there. And long term, they cause an effect of blindness, heart attack, stroke, kidney failure for dialysis. So to prevent that damage from occurring and going up to the diabetes years before it can start causing that problem, pre-diabetes needs to be treated. You need to consult your healthcare provider and they will recommend what you should be taking. Now coming to the two main types, type 1 and type 2. In type 1, you have absolutely no insulin. So your body cannot make any insulin. The insulin is produced by, between the rib cage in the center at the back, there is an organ called pancreas, and they have specialized cells that produces insulin. So some people are born where they don't produce insulin. Also, later in life, you can get type 1 diabetes. As the most common reasons for getting type 1 diabetes later is, one is infection. Some of the viral infection not only cause infection, but they go and destroy the cells that produce insulin in your pancreas. So people develop type 1 diabetes in their 20s and 30s. Any type, any age, 12, 13, any age, you can develop type 1 diabetes. The third most common cause is autoimmune disease. What happens is when we get viral infection or bacterial infection or any infection, we produce antibodies, and these antibodies are warriors in the cells that go and fight the foreign objects like the viruses, the bacteria and things. Sometimes these warriors mutate and they do not recognize the foreign as to be attacked, but they recognize some of the body organs to attack, and they attack your body organs. So autoimmune is when your antibodies go and attack your pancreas cells and kill the pancreas cells, and you can get type 1 diabetes. There are other reasons for type 1 diabetes, but this is the most common reason. Type 2 diabetes is mostly for most commonly two reasons. One is you have very small amount of insulin, or your body has become resistant to insulin. So you can have very high amount. The pancreas are producing insulin after insulin, but insulin is so ineffective that it cannot move the blood sugars from the blood vessels into the cell. Now, in a very easy way, what is the function of insulin? If you take cell as a room and there's a door and there's a pathway out from the door. On the door, there is a lock. So sugar is the person coming on the pathway to come inside the room. The lock is opened by insulin. So either if it is too less, it opens some of the doors, some it does not, or it's too little to open every, and blood sugars cannot move in. So we need to help this insulin to make blood sugars move in. Or you have a lot of insulin, but it has become resistant, like there is a wax, or the lock is frozen, or the key is not matching. So there is enough insulin, but it is not able to open the lock for the sugar to move from the pathway inside the cell. And it is needed inside the cell for nutrition and for its livelihood and things. So that's why, sometimes people have high blood sugar, but they lose weight. So the inside of their cell is starving. They don't have enough nutrition because insulin is not enough present or is resistant, so it cannot move the sugar in. So the inside of the cell is starving while there is enough insulin. So this is a very easy way to explain what insulin is, what it does, and why blood sugars are high. Blood sugars high sometimes cause no symptoms. People, sometimes I've had patients say, why should I treat it? I have no symptoms. Well, the reason you need to treat it is because if you don't treat it, over time, high blood sugars cause complications. The complications can be heart attack, stroke, blindness, kidney failure going on dialysis, or gangrene in your foot, or places where you need amputation of the foot or leg. These are some of the complications. There are many, many, many more complications. It's a very complicated disease. And it's a very common disease. A lot of people have it. So if you are discovered or found out to be pre-diabetic, you need to take care of yourself and you need to prevent it from turning into diabetes. How do we prevent people becoming diabetic? Now, type 1, I told you, we can't help it. It happens, and your cells are killed either by the virus or by the antibodies, so you have no choice. It's not your doing. Type 2 can be because there's decreased insulin, and decreased insulin can be because you have overstimulated your pancreas. You eat too much sweets, you eat too much sweet stuff that makes your blood sugars high, and your insulin is normal. You're not with diabetes, and you're producing more and more insulin, and you get burnt out, and your insulin burn out. So you need to protect that insulin. The most other common reason is for resistant insulin is obesity. When you have a lot of fat in your body and you're obese, think that the fat goes and blocks the lock that lets the sugar enter in. So you have enough insulin, but it does not block, and overstimulation of insulin then causes failure of insulin. So to make blood sugars down, you need to take medicine. If you are now diagnosed with diabetes, there is no herbal treatment, there is no certain miracle herbal or food that can make you become non-diabetic. Once a diabetic is always a diabetic. You can control it very well. If you are obese, before your insulin burns out, lose weight. It's not easy. I have suffered from obesity, and I have been all my life. I mean, when I was young, I was very skinny, so I never thought I'll gain weight, and I've had problems. So it's very easy to say lose weight, but it's not that easy. But one of the things is eat healthy diet. Eat healthy diet does not mean fat diet. Eat everything, but in small portions. So if you're eating rice or pita or bread, eat that, but in small portion. Eat normal, healthy, home-cooked meal. Avoid all kind of sweets and desserts, and avoid sweet drinks. One of the sweet drinks is people have the misconcept that if they make fresh juice at home, whether it's orange, carrot, or apple, it's very healthy. No, when you make a juice, you have taken the fiber out of the vegetable or fruit, and you've turned it into a full sweet drink loaded with sugar. So it's better to eat fruit, it's better to eat vegetables, and not to take out juice and drink it and make it a high sugar drink. Avoid sodas. Studies have shown, in some studies, that even diet sodas are known to be causing diabetes, because people who have for years and years and years have been on diet drinks and sodas and diet food, low carb food, they somehow are obese, and they do turn into diabetes. So eating healthy is one of the important things. Second is exercise. You don't have to be a marathon runner. If you walk 30 minutes, just imagine if your blood sugars are high, you can bring it down by medicine, which you should be taking, and you should be taking it every day, whether your blood sugars are controlled or not. These are not to be things to be taken when only high blood sugars. Diabetes should be treated by taking your medicines regularly every day and eating healthy. But if you go and exercise, if you go for a run or if you go for a walk, you can burn that extra sugar that's in your blood by this exercise. So I hope this is helpful. Many people had asked me for diabetes. I've made it very simple. This is not, giving you a deep understanding, but a very basic understanding of diabetes so you can take care of yourself. Important thing is take your medicines when whatever your provider provides you, not what you want to eat, but the medicine given by provider, because there are different things we need to be treating with. Take your medicines, eat healthy and exercise, and you can control your diabetes, and you can prevent the complications that can happen from diabetes. If you like my channel and if you like my topics, please press the subscribe button so you can subscribe to my channel. And also there is a bell down there which you can press on, so anytime new video comes, you can get a notification of my new videos. Don't forget to pass good comments. Even criticism is okay, but no advertisements. Give me your ideas, what you want to listen to. There are few topics I have got from other people, which I will be making videos very soon on. But for now, I hope you enjoyed this video.